Hi, I'm Alan Heincker. I'm one of the orthopedic surgeons here at Phelps Health. I became interested in medicine as I continued to do my career in running and sports, and I realized that there were lots of athletes that could live their whole lives and participate in sports and have no injuries, while others constantly had injuries that prevented them from playing or participating in sports, and it always made me wonder how I could fix that and how I could possibly help that in the future. I went to high school about halfway between here and St. Louis, a little town called Ditmer, Missouri. I went to Grandview High School, and then I ultimately went up to Truman State University in northern Missouri for my undergraduate, and I did my medical school over in Kansas City. I ultimately knew I wanted to do orthopedic surgery before I knew I even wanted to be a doctor. My dad was a plumber and my grandpa was a plumber, and I was going to end up being a plumber, but as I did my college career running cross country and track, I realized there was something more that I liked rather than plumbing. I ended up actually working at some hospitals as an aide and setting up dialysis machines, and I actually worked in the ER as a tech, and slowly I learned that I definitely wanted to do more to help people out, and ultimately I ended up shadowing an orthopedic surgeon, and that's when I knew that's what I wanted to do. 3 things that are interesting about me is, number 1, I really love running. I don't run as much as I used to, but I used to do a lot and I still enjoy it when I can. 2, I am super involved in sports, all different kinds of sports. I have young boys and my wife, and we're all very active. I help out at the university for S&T as well as the raw athletics in order to keep those kids playing and healthy. The 3rd one is I grew up on a farm with draft horses. We used to demonstrate a lot of horse-drawn equipment that there's not a lot of left in the nation, and I know how to drive a pair of horses, but I don't usually like to ride them. The times where I feel like I make the most difference in a patient's health are either when I get an athlete that has broken a bone or can't play, and then we fix them and we see them back out in the field doing their sport a year later, or something simple as just being at church and having someone walk up to me and show me their scar and talk about how they got better and how they're back to their normal lives, and they're thanking me and giving me a hug randomly at church or Walmart or at the sporting event. I hope that when a patient comes to Phelps Health that they feel like they got the attention they deserve. We do see a lot of patients here, and there are a lot of people that need help. Sometimes we're able to help some more than others, but I hope when you come to Phelps Health that you feel like you got treated like a person. I try to go over conservative treatment and surgical treatment, and surgical treatment can be a very good option, but usually only if you have failed everything except surgery to begin with.